You are watching this video because you or somebody that you love has been diagnosed with a shoulder separation. This video and the teaching aid that you've been given will help you understand what a shoulder separation is, what can be done to help you heal, and what outcomes you can expect. Shoulder separation is caused by an impact to the shoulder. This can happen when you fall off your bike or when you're tackled when playing football. The impact puts pressure on the joint between the collarbone and the scapula. The joint becomes displaced, and then the tissues around the joint can become damaged. The symptoms of a separated shoulder include tenderness and pain, bruising, and swelling in this area. You may also have difficulty lifting your arm, or there may be a new bump on your shoulder where the collarbone is sticking upwards. Your doctor may have looked at the area, evaluated your range of motion, or done an X-ray to diagnose you with a separated shoulder. To help you understand this injury in more detail, I will use a shoulder model to explain the anatomy. This model contains 3 bones of the shoulder. In the front of the body is the clavicle, on the side is the humerus, and on the back is the scapula. The more commonly used names for these bones are the collarbone, the arm bone, and the shoulder blade. There are 2 joints demonstrated here. The first is where the humerus meets the scapula, right here. The head of the humerus is like a ball, and it fits into the socket within the scapula. The socket in the scapula is called the glenoid fossa. So together, the humerus and the glenoid fossa are called the glenohumeral joint. When the head of the humerus displaces from the glenoid fossa, this is called shoulder dislocation. With a shoulder separation, we're concerned about the second joint in this model right here. This bony projection of the scapula is called the acromion. Where it meets the end of the clavicle is called the acromioclavicular joint. The joint is comprised of a cartilaginous disc between the 2 bones and a fibrous capsule filled with synovial fluid that surrounds it. It's supported by 2 ligaments. The first is the acromioclavicular ligament, or AC ligament, which spans the acromion and the clavicle and stabilizes the motion of the joint in the forward and backward directions. The second ligament is the coracoclavicular ligament, or CC ligament, which attaches from this bony projection of the scapula called the coracoid process, and it also attaches to the underside of the clavicle, just in there. It also has 2 parts, the trapezoid ligament and the conoid ligament. The CC ligament prevents the end of the clavicle from moving upward and away from the acromion. In a shoulder separation, impact to the shoulder causes this joint to separate, the AC joint, either partially or completely. There are different severities of separated shoulders depending on which of the AC or CC ligaments are injured and how badly they're injured. Treatment and outcome depend on the type of shoulder separation. The types are outlined in the teaching aid. For type 1 to 3, treatment is similar, but with different lengths of time for immobilization and to fully heal. Treatment starts with ice, anti-inflammatories, and possibly pain medication. The shoulder is also immobilized anywhere from 3 days to a few weeks to protect the healing joint. Eventually, exercises will be prescribed to maintain normal range of motion and to strengthen the muscles. In types 4 to 6, and sometimes type 3, surgery is required to mend the joint. I hope this video has helped you to better understand the injury and will empower you in your healing process so you can get back out there doing what you love.